For joining us today. My name is Amber Lee. I'm the State Director for Protector Care Alaska. Protector Care is hosting a nationwide tour to discuss the dire emergency created by the lawsuit to overturn the Affordable Care Act, as well as the upcoming battle over Trump's intent to fill the Supreme Court vacancy with a justice who opposes the ACA, which would throw our entire healthcare system into chaos. Between this threat to the ACA and the mismanagement of the COVID crisis, and the threats to women's reproductive rights, healthcare is on the ballot this election season. Our speakers today will talk about how these issues will impact Alaskans as a whole, and also a few of them will talk about how it would impact them as individuals. Our first speaker today is Dr. Al Gross. He is a lifelong Alaskan, an orthopedic surgeon, holds a master's in public health, and he is also a candidate running for U.S. Senate. Dr. Gross?
Thanks, Amber. And I'm also married to a wonderful woman who's participating in this, Dr. Monica Gross, who's a pediatrician and has a master's in public health. So we're kind of a two-for team. And I care a lot about healthcare, and I care a lot about Alaska. And I can't think of a more timely period to be running for the United States Senate, to send someone to the Senate to protect the Affordable Care Act, or help rebuild it if it's torn down by the United States Supreme Court. And I'm a staunch supporter of the ACA. I'm a staunch supporter of a public option. And of course, I'm a very strong supporter of women's reproductive rights. Our campaign is gaining momentum every day. Our fundraising continues to go extraordinarily well. We're being upgraded by political ratings organizations regularly. Ozzy has this race rated as a toss-up at this point. Sabatos upgraded us, I believe, for the second time, I believe 2 weeks ago. The Cook Report has already upgraded us once, and they're supposedly going to be upgrading us a second time, either later today or tomorrow. So the Alaska U.S. Senate race is very much on everyone's radar screen across the country right now. The polling shows that this race is neck and neck, and poll after poll done by different pollsters. This race is essentially a toss-up. It's very winnable. And as many of you know, Mark Begich only lost this race by 6,000 votes in 2014. We've got one of the most amazing ground game for a political race that Alaska's ever seen. And we're going to have hundreds and hundreds of paid canvassers just in Anchorage alone. We have the resources to be able to do that. So we're really excited to be part of this amazing movement. And I look forward to standing up for the things that matter to the people on this Zoom in a really strong way when I get to the Senate. And I'd like to be the doctor that gets the public option across the finish line. But if we have to rebuild the ACA from scratch, if it gets torn down by the Supreme Court, I'm up to the task, up to the challenge. And I really think it's super important that we protect coverage for pre-existing conditions, and that we protect the other things that the ACA provided. Keeping kids on parents' existing plans until the age of 26, and of course the Medicaid expansion, which has been so beneficial to the state in so many ways by providing health insurance for 45 or 50,000 Alaskans, and of course bringing revenues into the chronically underfunded native health system, which was underfunded through their compact system. So thanks for letting us be part of your program today. I'm looking forward to your questions as we move forward.
Thank you, Dr. Gross. Next, I will introduce Dr. Monica Gross. As Dr. Al Gross said, she's a pediatrician and holds a master's in public health.
Thank you very much. Good morning, everyone. I'm going to talk about this from a little more personal angle. I practiced pediatrics in Juneau for over 20 years, and so I took care of families and their kids. And it is absolutely critical that families have basic health care for their children. When families have to choose between buying food or going to the doctor, that's a choice that no parent ever wants to make. And being able to give kids preventative regular health care prevents so many chronic illnesses from getting worse, keeps kids out of the emergency room. Over and over again, studies have shown that primary preventative care helps kids stay healthy, helps families stay healthy. And the ACA, one of the parts of the ACA was to provide for basic preventative care. And we absolutely have to protect the ACA. And as Al said, if the ACA goes down, we need people in government who are willing to pick up the pieces and put it back together again and make it even stronger and better. And I want to give kudos to my husband because he's absolutely up for that task. And you couldn't send anybody better to the Senate right now to protect the ACA if we can, but also to rebuild it if any piece of it is torn down. There's so many aspects of comprehensive, affordable health care that are important. But again, my lens is through the eyes of families and parents, and it's one of the foundational building blocks of a healthy society. And I just feel so strongly about this. So I guess I'll leave it there, but send out to the Senate. It's very, very important that we have a doctor in the Senate right now. So I'll be happy to take people's questions later.
Thank you, Dr. Monica Gross. Next up, we have Jennifer Allen. She works to protect and promote reproductive health rights and justice in Washington, Alaska, Idaho, Hawaii, Indiana, Kentucky, and nationwide in her roles as CEO of Planned Parenthood Votes Northwest in Hawaii and Planned Parenthood Advocates of Indiana and Kentucky. Thank you, Jennifer.
Thanks so much, Amber, and thanks to all of you, to my great co-panelists, and to all of you who are sitting in today to talk about the really important moment that we're in. I want to be clear that nominating Amy Coney Barrett for the Supreme Court of the United States is an insult to the legacy of Justice Ginsburg, and it's a direct attack on our health and rights. Barrett is the antithesis of everything that Justice Ginsburg spent her life fighting for. She's an active and vocal threat to reproductive health and rights who believes that Roe versus Wade was wrongly decided. She's been openly critical of the Affordable Care Act and the 2012 Supreme Court decision that upheld the law. And she doesn't respect the impartiality that our justice system demands. She believes that judges should not uphold the law when there's a conflict with their personal religious beliefs. Amy Coney Barrett's actions have shown us that her beliefs are out of touch. She signed a letter opposing marriage equality, stating that marriage and family are founded on the indissoluble commitment of a man and a woman. And that's a view that's out of step with more than 2/3 of Americans today. I think that it's worth noting that our nation is facing the dual public health crisis of systemic racism and the COVID-19 pandemic as this is going on. And as this is going on, Senate leaders are promising to confirm Amy Coney Barrett, even as they continue to ignore the devastating consequences of these public health crises. Instead of passing COVID-19 relief or reckoning with that systemic racism and injustice that's plaguing our country, Senate leaders are preparing to rush to confirm this Trump nominee. And in Alaska, while Alaska was the 3rd state in the country to legalize abortion, Alaska is not a state without anti-abortion politicians. Just last year, multiple bills were introduced that would restrict abortion, including a bill outlawing abortion in the state, a 6-week abortion ban, a 20-week abortion ban, and a bill that requires medical providers to remove the fetus from a pregnant person's womb were also introduced. This is such an overreach into medical care. And it's not just abortion, which is and always should be a safe and legal and accessible right. But Trump's domestic gag rule on the Title X National Family Planning Program has left 3,400 patients in Alaska without access to care, which is nearly half of all of the patients served in Alaska by that federal family planning program. In 2017, 86% of Alaska counties had no clinics that provided abortion, and 32% of Alaska women lived in those counties. And let's talk about healthcare overall as well. With Barrett on the court, we're at risk of losing the Affordable Care Act in the middle of a pandemic, meaning 75,000 people in Alaska, more than 10% of the population would lose coverage. And that's not to mention the 119,000 people in Alaska who have their pre-existing conditions covered thanks to the Affordable Care Act, 26% of the population. And Medicaid expansion's at risk too, putting coverage for over 51,000 people in Alaska with low incomes at risk. As I think some of the previous speakers, the doctors Gross mentioned, access to healthcare, especially for low income people and people in rural areas, but for people everywhere, is a basic human right. And having it depends on a safety net that's supported by the federal government as well as the state. Being able to get basic health care, including a full range of reproductive health care that includes pregnancy and abortion care, shouldn't depend on your income or your zip code. In 2019, Planned Parenthood in Alaska saw over 7,500 patients. We know the challenges that people in Alaska face when they're trying to access their health care, and Planned Parenthood will continue to fight for health care access and continue to provide care no matter what. The stakes right now could not be higher. We expect our elected leaders to address the continued spread of COVID-19 instead of trying to ram through a Supreme Court nomination before the election. We must demand that the US Senate majority Republicans stop playing games with our healthcare and stop this unsafe and unwanted pre-election confirmation process. And the bottom line is this: there's an election coming, and it's the most consequential of our lifetime. All of us need to vote like our lives depend on it, because it does. Thanks, Amber.
Thank you so much, Jennifer. Our next speaker is Leighan Gonzales. She was born and raised in East Anchorage to young parents who worked multiple jobs to make their way through school while raising young children. She is the proud product of our public education system and spent her childhood benefiting from federally funded social service programs for low-income households. Her family relied on Denali Kid Care coverage when, as an infant, she had risky and expensive open heart surgery to repair a congenital birth defect, with years of recovery. This inspired her lifelong fight for affordable quality health care for Alaskans, just as her early years instilled in her a passion for justice and inspired her to campaign against special interests who seek to derail the programs of progress that made her who she is. Leighan?
Hey, Amber, thank you so much for having me on here, and thank you to everyone else who's a panelist. So I was born to teenage parents who worked minimum wage jobs. When I was growing up, I had a congenital heart defect. So I essentially was born with a hole in my heart. And I was the first member of my family to survive this defect because of the surgery that I was able to get at 5 months old. And I was raised on Medicaid, which allowed me to continually get the care that I needed as a young child. And for my family, it meant that I was able to get healthcare, and they weren't able to, or they didn't have to stress out about it. And then when the ACA passed, it allowed me to keep coverage under my mother's health insurance, which was a big relief for me as a college student to know that I had health insurance and that I couldn't be denied because of my pre-existing condition. And I also knew that I couldn't be denied now on the basis of sex as a woman for health coverage that I needed to keep myself healthy and safe, honestly. And the ACA allows those of us with pre-existing conditions to live our lives knowing that legal protections exist for us and knowing that our healthcare can be a priority that won't bankrupt us, that won't ruin us, that won't, leave us on our deathbeds when we're seriously ill. And looking forward to the ramifications of a SCOTUS nominee who doesn't believe in healthcare for all, who doesn't actually espouse those values that she claims to be pro-life. It's not pro-life to take healthcare away from Americans. And for me, I'm entering my late 20s and I'm wanting to have children. And that adds a new set of risks, that adds a new set of pre-existing conditions that insurance companies can deny me coverage for if the ACA protections are not in existence. And so it's terrifying for me as someone with a heart issue, looking forward to having children and giving birth in a country that doesn't care about me as a woman, that doesn't care about other women, especially with the Black maternal mortality rates in this country so extremely high. But if Dan Sullivan gets what he wants with the Supreme Court, healthcare protections will be stripped away, and families like mine would be most at risk. And the very real risk that my children will inherit this heart disorder. It's really scary for me to think about having babies, having a 5-month-old who needs surgery, but I can't pay for that coverage for him or her. And it's something that, could bankrupt my family to ensure not only a healthy pregnancy, which is what Dan Sullivan, as somebody who is pro-life, really advocates for, but having healthy children. And so if Dan Sullivan is working to strip ACA protections, if Dan Sullivan pushes forward a SCOTUS nominee who will strip our healthcare protections, that's not pro-life of him. And he should drop the label of being pro-life, but because it's clear he doesn't care about Alaskans and he doesn't care about healthcare.
Thank you, Leighan, for sharing your story. Next up, we have Richard Drake. He's a lifelong Alaskan, has spent countless hours, days, weeks enjoying Alaska backcountry through camping, hiking, skiing, snowshoeing, and alpine touring. 11 years ago, he noticed his stamina was diminishing, and he was diagnosed with hypertrophic cardiomyopathy. It's a chronic genetic heart condition. Richard?
Hello. Yes. So 11 years ago, I was diagnosed with hypertrophic cardiomyopathy, which, through no fault of my own, through no lifestyle um, practices, this is something that was a genetic marker that ends up making my heart muscle thicker, stiffer, and it makes it harder to pump blood. So over the course of the last 11 years, I've been on a downward slope of physical stamina to where 6 years ago I climbed Mount Rainier with a 50-pound pack, and now I can walk 2 miles with resting. And there's no turning back on mine. Mine is a progressive condition. So looking forward, one of the things that I'm lucky about is that our family does have good health coverage through my wife's insurance with the school district. And some of the things that we can take care of now are costs such as last year our out-of-pocket medical expense was over $15,000. This summer I had an ICD implanted. It's ICD is implantable cardio defibrillator. So it'll zap me back into rhythm should my heart go out of rhythm. That was an in and out day surgery that cost $136,000. And at one point, the insurance company, they approved it, then they denied it, asking for more medical evaluation or records and stuff, and then they approved it again. So during that roller coaster ride, that there's a stress that is involved, and one thing that the constant stress of health coverage or the anticipation of potentially losing health coverage from political whims is a real factor in our lives. My downward slope ends with a heart transplant. That's where I'm potentially headed. Heart transplants are the most expensive medical treatments out there. They can cost $1.3 to $1.6 million. So imagine not having a stable health insurance system to look forward to with something like that on the horizon. There's also another thing that's involved with some transplant patients is what's called a wallet biopsy. Person being put on a transplant list is evaluated for their financial ability to pay prescription costs of up to $2,500 a month for the rest of their lives. So it's really hard to believe that our politicians could decide to put people at risk by voting against pre-existing conditions, voting against any sort of stable health system that provides not just medical care, but peace of mind for people. Throw in not just one more thing, but another thing, and that is my son has type 1 diabetes. And speaking of prescription costs, insulin has been in the news for quite a bit for the cost increases. And as many people know, with type 1, insulin is a daily need, life-giving medication. So we haven't talked about prescription medications in this, but that is another more chronic cost of a lot of these conditions, not just medical events, but also continuing costs. And I guess that's where I'll leave it.
Thank you so much, Richard. Now we are going to go to a question and answer period.
Thanks, Amber, and thank you to all of our panelists and for everyone who is joining us on Zoom today. If you have a question for one of our panelists, please go ahead and enter that into the Zoom chat box now. Or if you're joining us on Facebook, you can go ahead and leave a comment with a question on the live stream. We do have one question coming in already, and the question is for Dr. Al Gross. The question asks, how would the Trump administration's lawsuit to eliminate the Affordable Care Act affect people with pre-existing conditions in Alaska? I know we've touched on this a bit, but wondering if you could elaborate a bit more on how the Affordable Care Act protects people like Leighan and like Richard.
Yeah, well, it would definitely put that at risk. And if that lawsuit gets to when it gets to the U.S. Supreme Court and they decide if they do that the ACA is unconstitutional, then protection for pre-existing conditions is gone. And we're going to have to step up and write new legislation to ensure protection of pre-existing conditions in another fashion. And that's why I think it's so critical that we send people to the Senate right now who are willing to stand up on behalf of women's reproductive health care and pre-existing conditions and affordable health care in general. It's going to be a huge problem nationwide. And to do this in the midst of a worldwide pandemic is just unconscionable. How can you take away healthcare in the middle of a crisis? It's just unbelievable. And I think the Trump administration is actually imploding at the moment because, of course, they're all getting infected with COVID-19, and they really don't have a leg to stand on right now talking about healthcare. And I knew when Monica and I moved to Anchorage 3 years ago from Southeast Alaska so that I could dip my toe into the possibility of doing this, I knew that healthcare was going to be at the top of the ticket in 2020. And I had no idea, of course, that we'd have a worldwide pandemic on top of that. But here we are. And it is the number, or certainly it's at the top of everybody's mind is their health, I guess. And then the idea of stripping away these basic guarantees is something that isn't going to fly very well within our state or our country. So I think we're in a super strong position to win this race, in part because of that, and for other reasons as well. And I'll work really hard when I get to the Senate if they do tear down the ACA to make sure that we have something in its place that protects all the things that we're talking about today.
Thank you, Dr. Gross. I'm going to put out another call to folks who are joining us on Zoom to leave questions for any of our panelists in the Q&A or the chat box at the bottom of the screen. We can go ahead and field those questions if you enter them there. And if you're joining us on Facebook, you can leave a question in the comments on the live stream and we will do our best to get to that as well. We do have another question for Leighan. This question asks, Leighan, could you describe a little bit more about what losing the Affordable Care Act would mean for someone like you and what the stakes are for you in November?
Absolutely. Thanks for that question. Losing the Affordable Care Act for me means adding another healthcare barrier that's completely unnecessary. I mean, I not only just for myself, but for the children that I would like to have. I mean, I would like to have a baby in the next 2 to 3 years, and not having ACA protections means that my child can be denied because they inherit my heart condition. And so for me, especially at this, this stage of my life, it's not about me. It's about the future. It's about the family I want to raise. And so losing ACA protections for myself is one thing. I can figure it out. I can navigate. That's in and of itself. But losing ACA protections for my children, it's not only a deterrent to have babies, but it's a deterrent to it's a constant fear. I mean, it's something I've wanted my entire life, and to know that my my government doesn't care enough about us as Alaskans, as Americans. They don't care enough about our children to make sure that they can have health coverage. That really hurts.
Thank you, and thank you for that question. We do have one question coming in from Kathleen Bugby, and it's to the panel itself, so whoever wants to jump in on this. The question asks, has there been any recent polling in our state about the ACA? And what do Alaskans feel about the ACA based on what you know from the folks you're talking to?
Well, I can speak to that. I've seen a lot of polls lately. Alaska is a pro-choice state, and Alaska is strongly in favor of protecting pre-existing condition coverage. So there's strong talking points, and we're in a really good position because of that.
I'll just also add in being able to expand coverage to the working poor is very, very also positive, because these are people who go to work every day and weren't able to afford health coverage through the private system, but are able to access Denali Kid Care because they've upped the number for being eligible. And again, it's a very popular system because parents, it's an impossible choice for parents to have to choose between their kids' health care and food on the table. And as Richard talked about, the cost of insulin for families that do have children with conditions, it's an impossible choice, and no family should have to make that choice.
And as an orthopedic surgeon, I saw people denied care because they lacked insurance. And I'll never forget somebody who was dragging his leg as he walked away from the clinic, saying, "Well, how am I ever going to get a job if I can't first get my leg fixed?" And of course, he couldn't pay to get his leg fixed because he was totally in the catch-22 situation. That kind of person was covered by the expansion of Medicaid in Alaska, and will now have opportunities to get their disabilities corrected so that they can go back to work.
And I'll just add in one other thing. When parents didn't have health insurance for their kids, they would end up in the emergency room. These are families, kids with asthma, something that is a very treatable illness for a family. And unfortunately, if families aren't able to access the medications that they need and to get some regular care through their doctor, these kids end up in the emergency room, they end up in the hospital, and the costs are actually bigger to society as a whole. So providing this basic care is, it's a win-win all around. It's a win for the family, it's a win for the kid, and it's a win for our system. So again, I would just say it's very popular to have this expansion of care and very necessary.
And one of the things that I think pre-existing conditions in particular, people are supportive of those protections because if you're a woman, that's a pre-existing condition, and pregnancy is a pre-existing condition, asthma is a pre-existing condition, and people are making decisions. I have a hereditary syndrome, leiomyoma and renal cell cancer syndrome. And my kids had a 50-50 chance of getting it. And I waited to have them tested because I was weighing the risks with everything being so up in the air about health insurance, the risks of them being identified as having a pre-existing condition with the risks of them getting the cancer. And the kids die of it as young as 8 years old. And so for families to have to make those life and death decisions is abhorrent. You shouldn't put that on people who are already under a lot of stress. But everybody has somebody in their family or their friends or their neighbors who have pre-existing conditions.
Well, and let's not forget about COVID-19. I mean, everybody's going to get sick from that, and there's going to be an awful lot of pre-existing conditions as a result of that. So how can you strip that away in the midst of a world crisis?
And unfortunately, it's looking like some of the people who get COVID do go on to have a chronic condition that needs care. And so just as Dr. Al said, that puts people in an impossible situation.
Thanks for touching on that. That's actually a question that we had come in as well, is how are the people who are surviving COVID but left with long-term conditions going to be affected if the Affordable Care Act is eliminated and those protections disappear overnight?
I'll start. I just think we can't let that happen. It's, we live in one of the richest countries in the world. We can't let that happen. And, not to keep plugging Al, but we've got to send Al and people like Al to the Senate to make sure that doesn't happen. It's just, it can't be possible to let that happen. That is just an impossibility.
Thank you, everyone. It looks like those are all the questions we have coming in at this time. So Amber, I am just going to turn it back over to you for some quick closing remarks.
Thank you, everyone, for joining us today. This is and for sharing your experience and for sharing your personal stories. This is a critical issue in Alaska for the state as a whole, for our economy, and then also just on a very individual and personal level for all Alaskans across the state. I would encourage anyone who was on the call who didn't have a chance to ask their questions. You can reach out to me or reach out to any of our panelists for follow-up. And I would like to thank all of our panelists for taking the time today to talk to Alaska, to address these issues, for fighting for our healthcare and our reproductive rights. We all really appreciate you being here today. So thank you. And with that, we'll let you all go.
Thank you.
Thank you.
Bye, everyone.
Have a nice morning.